So just a little bit about me then, as a background to me. So my role within the MAST project with Policy and Practice was business analyst. And so that was about understanding, gathering information requirements, system requirements, use cases, etc., from the partners, and really understanding how they would use the information, understanding what the information is, and how it's held, how it can be extracted, and how we can put that into the system and present something that is of value. So that was my role within this this project. My background is local government. I've worked in revenues and benefits in local government in and around that space for quite a few years, more than I care to remember. I've also worked with central government, DWP, HMRC, Cabinet Office, whilst working with a credit reference agency, doing mainly fraud and error products. But again, it was leveraging data for those organisations and providing data solutions. So that's me. That's my bio. And so what I want to do now is just remind you that please, we can make this as interactive as you know we want. So if you have questions, then please shout them out, and we can tackle things as we go forward. What I'm going to do first of all is share my screen. Always the scary part. So you should hopefully be able to a presentation. I'm very conscious that I don't want this to be death by PowerPoint. You've seen loads of PowerPoints, and I'm conscious this is a demo, and we will get to the demo. And actually that's you know a relatively simple part. But I think there's a few things that I'd like to pick up on that Devon might have mentioned in his introduction, but he went over things really quite quickly. So there are some things that I want to really sort of hit home before we get into this into the demonstration itself, and those are things around the purpose, what we're doing, and you can read off the screen what the purpose of MAST is, and what Paul Withers very eloquently described. And I think when we describe what something is, it is also very important, I think, to say what it isn't. And that's it's not profiling, it's not automated decision making. We're not attempting to replace professional judgment. All we're really doing is providing in a timely manner all the available information, and that is intended to aid the way professionals make informed safeguarding decisions. It enables officers to make rapid checks across safeguarding partners. And the phrase that came up quite often when we were talking to social workers was professional curiosity. So it's about feeding that professional curiosity with all of the available information in one place, and that's the key thing. That's the key thing that MAST does. It pulls all of this information from lots of different places and puts it together so you can make sense of it very, very quickly and easily. And so the process that we went through with each of the partners within the Walsall group, first of all, that data sharing agreement and that memorandum of understanding, that the information governance was absolutely key. That's the critical path. We can't share anything until that's in place. That was right up front. And then it was about holding workshops with each of those partners to understand what their interactions with customers were about, understanding what type of interaction it was, what was a significant interaction, what was something that you wanted to share, what was a record, what did the record look like, so we could define a data schema. And actually, it's very, very simple. So the data schemas here are incredibly simple, which I'll come on to another slide in a second. And then it was about getting a sample extract so that we could start to look at the information and try and make sense of it and see what that overlap and that match rate was across the different organizations. So we set up a SFTP connection, secure file transfer protocol. We got some data across, and then we started to make sense of it. And then we moved to that daily feeds update. So we're now getting daily updates from each one of those organizations, which is amazing. So in terms of those data concepts, it is very, very simple. There are only really two concepts within MAST, and that's person and place. So person information is name, gender, date of birth, and place is a residential address. And it's really as simple as that. There is some associated information, or rather information associated with that personal place record. That is the organization, so the contributing organization where that information's come from, the date of the interaction with the customer, and a reference number that originates from that system, and where it's held, the contact or lead officer that was involved in that contact. And that's really just about providing a lead, if you like, for those people making lateral checks to be able to quickly identify who it is that they need to speak to from those organizations if they need to follow up and get more information about that interaction. And, you know, Devon stressed this, and I'm going to stress it again, there is no case information in here. We have no information about why the police was called out. We've got no information about what the A&E visit was all about. All we know is that this person had an interaction with this service, or this service had an interaction with this place. So no case level information in here, and that was one of the sort of key points to the information governance data minimization principle that enables this more easily to happen. So we have a couple of different interaction types. So I talked about interactions between services and customers. So there are two different interaction types. One is essentially a discrete interaction. So that's a 999 call. So that is a single separate entity in terms of that interaction, a 999 call, a blue light, a fire visit, a police visit, an NHS visit to A&E. That's a single thing that happens at a moment in time. And then we have the concept of an open case for children's and adult services. So a case is opened at a given point in time, and that is then a shareable record. And, you know, we had debates with the social workers about what that given point in time is, because there is a process, obviously, as you know, where a case is, you know, a concern is raised and it goes through as a process to decide whether it's going to be taken forward or dropped. So it's at the planning meeting stage. So that was where that case is being opened, and that is at the point at which they share the record. So in terms of person and place, we have person and place information from adults, children, and NHS, and place only information, so that's just the address, from fire and police. And then we have, as I said, automated daily feeds. So in the initial data matching exercise that we did with a bunch of test data over a 3-month period, July to September, the sort of eureka moment, I think, was where we put this information together and we could see that there was a significant number of matches across these partner organizations. So obviously there was interactions with people and places that were shared. So 23% of cases were matched with at least one other record. Half of children's records and 2/3 of all adults' records matched with at least one other data set. So you can start to see that, you know, there is a significant amount of matching going on here. And you know, there were some other little tiny nuggets that came out of here that were really interesting. So for example, children's and adults matching. So even though this information was coming from the same system, same mosaic system, those two data sets were ring fenced within that internal system, and the users did not have overlap, so they couldn't see each other's cases. So there were two matches where people in the same property were known to children's and were known to adults, but they weren't known to each other. So that's, you know, a really sort of interesting finding from you know, just the initial matching that we did. And you can see the volumes of data that are flowing into here, you know, quite significant numbers of cases that we're dealing with. And this now is my prompt to start actually the demo. So we have a mobile app as well, which this slide alludes to. But what I'm going to do is now I am going to stop sharing for a second. No, I'm not. I'm going to go to here. Now, hopefully you can now see the login screen to MAST. I'm going to hit sign in. It takes me through my single sign-on credentials, and I'm in. So the first thing I start with in here is a declaration. So one of the really important parts of designing the system and talking to each partner, and specifically Paul Withers, the Data Protection Officer at Walsall Council, was to make sure that we have a very robust audit logs for access to the system. Obviously, we, as organizations, you're not going to give system access to people who don't have it, shouldn't need it, shouldn't have it. But we back that up with good audit records and a declaration. So with all of systems like this that are accessing information that might be controlled under GDPR, Data Protection Act, etc., we like to have a declaration that says, why are you doing this? And do you understand that misuse can result in disciplinary proceedings and potentially prosecution with Data Protection Act, of course. So this is configurable based on the organisation. So I'm going to access this under a particular piece of legislation, and I am going to tick to acknowledge that I might be liable to disciplinary proceedings or prosecution if I misuse this information. So once I've done that, I can then log into the system, and we're presented with a very, very simple search box. So what I have here is a very small demonstration database populated by fictitious names and addresses. So I won't be able to see all of the functionality in here because I've got only a very small limited number of cases in here. However, what I'll do is I'll take you through some basic searches, and we'll look at how the results are returned, what use case that might represent, and just really show you how we visualize this information, which is a really important part of the demonstration, really. So up here, I have search, I have my audit records, which I'll show you at the end, user management, user permissions, etc., and a simple sign out. So to start with then, I have a very simple search. I can search by name, lots of combinations. I can do name, I can do dates of birth, I can do address and postcode. And if I know the reference numbers, then I can use those. So, any reference number, whether it's an adult's or children's reference number, would sit in here. If I know the NHS ID, it would sit in here. And actually, typically, also with police records, it is simply anything that we've mapped to an ID, a reference ID field. So if I know those pieces of information, I can tap that straight in here and go straight to a given person. We know that we've got pretty good population of NHS reference numbers, patient records, across adults and children's services. I think when we looked at the Warsaw data, it was around about 95% of cases have a valid NHS reference number allied to those associated with those cases. So a really good piece of information that we can use, and we take that in the data schema that allow us to match people. So the matching that goes on in the system here is partly where we can, where those reference numbers are in the schema and has been populated, we can simply use that, or we're using name information here with date of birth, or we're using address information. And just to talk about those for a second, name and address matching is notoriously difficult across different platforms that might have different metadata standards, that might have addresses and everything held in 4 different fields or 3 different fields. So it can be problematic. So we use a couple of different techniques in here. So with name matching, there is a degree of fuzzy, but it's a deterministic style approach. And we can leverage other sort of dictionaries around different variations of names, and that's could be across various different ethnic backgrounds as well. English, Europe, Eastern European, Asian as well. So, Jim, Jamie, James, all of those different things. So we can have dictionaries that sit behind here that allow us to have a much better chance of identifying the right person. So that's really important to recognize, and I will show you a little bit of that in a second. With the address population, we are leveraging the GeoPlace UPRN. So even though you might not have the UPRN number within your system, and actually a lot of the legacy systems that we see are not selecting an address from a drop-down that is produced via a UPRN or from GeoPlace, we can still triangulate that information, because basically what we will do is a lookup of the address as it's been given to us in the schema, and we will do a lookup directly against the GeoPlace UPRN for each one of those. So that allows us to triangulate the information. So if I had, 1 the High Street, Swindon, and in another data file I've got Swindon won the high street, then in a normal deterministic matching, you might not match those together, but both of those would match with the UPRN in the GeoPlace database very well. So then I'm just going to match using that UPRN that I've pulled down from both address fields. So that's how we get around some of those different problems. What I'm going to do is just show you the searching. And the searching really is in two stages. So the first stage is to look, for an individual. So I am going to look for this guy. This is all made up names. So I've got a guy called Benjamin Adrian, and I'm going to look for him. And it's returned a result. So what this is saying is I've looked for Benjamin Adrian, and I have found a record. And now this record has got a person, it's got a person attached to it, and it's also got a place attached to it. So I could then have the option of either searching by the person to look for all the records for this person, or I can look for all of the records that are associated with this address. And obviously you can see the difference between those two sorts of searches then. So if I look at 32 Portland Street and search by that address, I might find more than just Ben that lives there. And equally, if I search for just Ben, I might find more instances of him at different addresses. I'm just going to go back and show you one of those features that I mentioned earlier on about name types. So I've just put in Ben, and I've still found Benjamin Adrian. It's still the same guy. And if I wanted to, again, I could put in a date of birth in here, use the information that you know. Search again, and there I found him again. So lots of different ways of putting that information in. I'm going to go back and just show you that from the address point of view. And again, I've only got one. I said it was a small database. I've only got one Portland Street address in here. Let's go back, and I can put just the postcode in. I don't have to put any delimiters in the screen. It's just any. I can put it in any order. This time I might find I've got more results. Okay, so I've got lots of, I've just put in a postcode area, so I've got lots of different cases in here. There's my man down here. So what I could do here now is I'm happy that I found the right person. It's this chap that I'm looking for. So I'm going to just do one of these searches. So I'm going to do an address search, and that's going to bring back the records that it's found. So in this instance, it's only found one record. And we've represented this just in a tally chart here, just to show you how many records from each one of the partners that it's found. But importantly, we've also got a timeline here as well, so we can see when that record was first introduced into the system. And so that visualization, it's very simple. We've got one person, one address. I've got one record, and it was found here. That's the point it entered the system. I can go to the details here. So this is the record itself. This is the extent of the information that was shared. So that was the person, the date of birth, the gender, the address, postcode, the UPRN that we've pulled forward from the GeoPlace search. And then I've got under the organization, I can hover over that, and I can see the person associated with this case. The date that the case, the record was first introduced, the ref ID, and the population of the NHS number where it's available. So that's a very simple version of that search. I'm going to go and do another search now. And this time we're going to pull back more information. If I could spell. Okay, so this time what I've got is I've retrieved lots of records. So I've put a basic search in for Edna, and I found lots and lots of different interactions with this person here. So I'm going to do an address search, and this time what you can see is that I've got a number of different records. You can see there's lots of different interactions, and now you can see when those interactions were first happening. One of the features of the system when it was first devised and the information governance documentation written was all around the duration of how long this information would persist within the system. And initially, the information governance documentation said that we would only hold records and surface records for a 12-month period. So that was the period that it was deemed to be relevant for, you know, cross checks, lateral checks, etc. And so so information would drop off the system once you'd hit that 12-month period. However, there's been a revision to that recently because there has been a desire now to look at this information over a much longer period, over a 3-year period, but only for data analytical and reporting purposes. So we can surface information for 12 months for the purposes of doing a search, but we can use the information for reporting purposes longer than that. And the use case is all around establishing the impact of the interventions that have been put in place. So, for example, you might have a case where you have lots of different partner interactions, and then through adult services, children's services, whatever it might be, an intervention would be put in place. And the objective really is that the number of interactions that you get across the partners would diminish, would reduce as that intervention comes into effect. So under the analytics that we'll be able to produce out of this is we'll be able to show the time series and the time point at when interactions were happening initially, when an intervention was put in place from adults or children's, and then what the impact of that had to all of the different interactions, and hopefully we can see them diminish. But what you can see here in this instance is that we found actually 2 people within this address, and you can see these are the different cases, and these are the time periods that they're happening. So you can see we've got lots of different interactions happening. They spike around this April-May period. Again, this is my test database, so I haven't updated it with information from sort of August, September, October. But you can see here really quickly and really visually how those interactions have spiked, and maybe they're tailing off again now. But I think the key thing here is if you look at the details, there is a lot of interaction in here, and we can see lots of different records coming across from different services, and actually making sense of all of that information quickly is quite difficult. So I've not only got Edna Minks here, I've got Mark Minks, I've got lots of different records here, and making sense of that is quite difficult. But in the summary view, it's very easy to see you've got lots of interactions from lots of different services, and you can see when they happened. And that's really the key point about MAST, is it visualizes this information in a very, very digestible format. That would be, you know, an example of looking at a case like this might be, you know, this already has an open adults case. You might be looking at this case to decide, you know, has anything changed? Have there been any more recent interactions? Is there something I should be doing with this case differently, maybe? And I think Devon sort of talked through some of those results from the deep dive sessions that we had, and I've got those. If we wanted to look at those again, I've got those on the slides, so we could look at those. What I want to do is just perhaps show you another example of how you might use this in a case closure situation. So I've got this person here, Samantha Lancaster, 6 Granville Street. I've got lots of records in here. I'm going to search by address to pull everything back for this particular address. What I can see here is I've got a load of different interactions, and they start in November last year. I've got 3 NHS records, 1 police record, a children's record being opened, and a fire service record as well. And then just a little bit later in December, there is another interaction, but then there's a gap. So it all sort of tails off at this point. And you know, if you were looking at this system in sort of now, maybe July, August, September time, and you're saying, you know, do I close this case? Well, actually, you can see there'd been a lot of other interactions with services very recently. So perhaps, you know, your professional curiosity here might say, actually, I don't really want to close this case right now. I think there are other things that I need to be worried about. If I, you know, for example, I went down here and I wanted to see who to talk to. Okay, so I know the officer in charge of that particular call out was Dave Smith. There's his email address. Off I go, and I can contact that person. And so those lateral checks become, you know, very quick and easy. You've got a really good snapshot view of what's going on in that case. I'm going to do another one now. So here's Carly. I'm going to do a search for Carly. And I can see that I had a Children's Services case, I had NHS records and police records, but they're not recent. So there's nothing in the timeline over the last 12 months here. So if I was looking at a case closure in this particular instance, I can see that, you know, for all intents and purposes, it looks like there's nothing going on in these individual cases. You might decide, you know, this is the one that we can perhaps close with less you know, concern. So those are, you know, just really very simple searches, and just showing you the way the information is presented back to you. That, you know, it is very simple. Essentially, it's person and place, and all we're doing is matching where multiple records have the same, you know, name and address information. The magic is in how we do that, but it is you know, it's very simple, really. What I want to do is show you the audit records. So with each one of the users, you can look to see what their activity has been, and you could look to see that over a given period. So I look at my searches over the last week, for example, and it shows you who I've been searching for, when I did it, what I ticked in terms of the purpose right at the outset when I logged into the system. So that can validate what you're doing, and how many records were returned during my search as well. So one of the other things that I didn't show you, and I will just bring it up again with just a simple search, is we have a tab for analytics. So we have the summary, the details, and the analytics. That's not in my demo version, unfortunately. I can't show you that, but essentially that will be in the form of a report, which is similar, if not identical, to what we delivered through the trial period of that initial 3 months. So we will show all matches across all partner organizations over a given period. So that would allow you to start to pick out those high frequency addresses. The use case for MAST is different depending on which organization we're talking about. So for adults and children's services, obviously we're talking about the need to safeguard and, you know, the actions and interventions that you put in place. But for other organizations, then it's different. And actually, you know, each partner organization is contributing information around the principles of reciprocity. So, you know, you want to get out, you know, what you put in. So for fire and rescue, that's around identifying high risk fire addresses so that they can deliver preventative measures there. So where West Midlands fire and rescue team have their safe and well visits, which they do with all of the addresses that they deem to be at an elevated risk of fire risk. And for police, it's about identifying high frequency addresses that are a drain on their resources. So it's about identifying those high frequency addresses where there could be or is already a social services involvement, and liaising with those social services in order to get the right interventions in place, and obviously with the aim of reducing future demand. Okay, what I'm going to do is, that's probably about as far as I think I can go today with this. I'm going to stop sharing and I'm going to come back to here. Hello. So just have you got any questions?
There are a couple in the channel there, James.
Okay.
But also, Lucy, you've come on screen, so have you got a question?
I do, thank you. I couldn't remember how to. I'm having problems with my screen. Couldn't get back to the chat. Sorry if this has already been covered earlier on this morning. But when you talk about NHS, which areas of the NHS are feeding in? Is it urgent care and A&E? Is it other departments as well? Or?
Okay, so what we scoped out with the Walsall NHS Trust was its A&E visits, and its did not attend. So where there was, a scheduled appointment to be made, then it's the did not attend, and those were the ones that were sort of put in scope. But equally, it's any interaction that you, as professionals, would deem to be significant. So that's what we decided in that environment. Your definitions could be different, and we could simply adapt that for whatever your needs would be. Question, no problem. Question about the spellings of names. So you've got various different spellings. I did an example there of Ben and Benjamin, and then we had another of, actually I could have showed you about Fred and Freddie and Frederick and all of those different things. So we in the initial matching engine is looking for exact matches, but then there'll be variations from that, and I can't remember the name for the logic that goes with it, but the distance of how far away it is from what was searched for. But we'd also have the ability to do a specific lookup based on different types of names. So you've Jackie, and Jackie. There are sort of several of those. Jim, Jamie, James. All of that is available through a separate lookup that sits in the back of the search engine. So we can do that for, there are dictionaries available where we can take that for European style names, English style names, and also Asian style names, and they're all different sort of formats of what those would be. So that should all is all built into that system. When you look at the audit record, you can see which records the person has been accessing, not the number that the person has accessed instead. Okay, so that would be the next step of the drill down. So we can either do this as a report, or you can have the next step would be just to click that, which I haven't got in my demo system, unfortunately, but you would look at that and click through to a drill down, and it can take you to that record. We can take that audit journey, that audit log, as far as we need to, really. If it needs to be downloadable, we can do that. And whilst I'm talking about what's downloadable and what's not, and there's always a question about interoperability. These are very, very simple data schemas. We ingest the data it could be CSV file, it could be a .dat, it could be pipe delimited, it could be text file, it could be anything, but it's very simple. And we would export in the same way. So it could get ingested into your systems. If you wanted to put it into, into some other system, we can do that too. And the other thing to stress, and I think this was mentioned before as well, but just to bring it out again, is that nobody is typing extra information into the system. We're your systems people are doing bespoke queries behind the scenes that are very simple, saying let's just take all of the records that happened yesterday, and that's how the daily feeds happen, really. So there is a for the Mosaic system for adults and children's at Walsall, and for all of the other partners, it is just saying give me all of the records from the last 24 hours, and that gets uploaded to us. You don't have to type this information in as a separate interaction. So it gets pulled from your system, it gets ingested into our system, and then we represent it in MAST without really anybody touching it. And I think we have another question. In a project such as this, the biggest challenges, problems you encountered when trying, okay. So the biggest challenge really in this instance, and bear in mind we were doing this through the pandemic, was getting hold of services that were very, very stretched at the time. So you can imagine how difficult it was to get hold of NHS people during the pandemic, and also adult service, children's services were very busy. So initially, it was about just getting engagement from the right people. Paul Withers did a sterling job at Walsall Council to get the right people on the calls and round the table. And I think as we sort of moved into a normal world, then I think that will be a lot easier. I think it was very problematic through the pandemic, which I wouldn't expect that to be in the future. It is, I think, managing multiple partners that's probably the biggest challenge. Actually, the systems element wasn't difficult at all. What we're asking for from the systems and those systems people, the data managers, was very simple. And I think a lot of people would look at the data being the issue. It really wasn't. It was about getting just access to people because everybody was very, very busy at that moment in time. I don't anticipate it will be that bad in the future going forward.
I think just to add to that as well, James, from what Paul said this morning about getting the right people at the right time in the project, isn't it? And having that senior sponsorship to actually drive it all forward.
Exactly.
I had a quick question as well, because you showed us that there was an email address of someone that could be contacted for that lateral check. Can that be a telephone number, or can that have more data in that field?
Yes, in the schemas, we've defined email address and telephone number. So it could be either of those. I think in my demo database, I'd only populated the email address, but it could be either. We could put any of that information in. And actually, equally, it could be, a default one as well. So if there isn't, sometimes there isn't an individual attached to a case or to an incident, it might be, the default safeguarding lead or something like that. But, you might already have access to that, or you might not. So we can populate that with whatever you want.
Brilliant. And just picking up on what Lucy said as well, that those data sets from health, we've had interest as well. I think Devon mentioned it before about mental health records, ambulance records. I know we're speaking in South Wales about bringing in education and probation. There's also sort of this concept of read only, isn't there, in terms of some of the partners?
Yes, that's right. So it's really, what's of value to you. Is your data more valuable to be in it, but you don't need to see it, or vice versa? So yes, we can have a read-only access where you don't have to necessarily contribute data yourself, but you have a valid interest in seeing the information that's in it. The system that we've built is sort of infinitely scalable, and we talked about. Or Devon talked about the potential for a national system. It's been built at a database level, at a regional level, but we could just and they're ring fence. So you might have here's the West Midlands, and it's got these local authorities within it, and this is your catchment area of your fire and police and and NHS. However, that could be contiguous, so we can just bolt on additional regions to that, and the database is scalable, and it's structured such that we can just bolt on new regions as they come on stream. So within the memorandum of understanding that was created by Paul and the partners, there's the facility there to allow in more partners, so they would simply come and be part of that arrangement, and then actually bolting their data into the system, it becomes very, very easy.
And I know I've shared the information governance documents with, I think it's Adam and Lucy who are on this session. So just to say to everyone else, we can share those IG documents for you to have a look at to ensure that they sort of meet your requirements and so on. But they have been through quite a big peer review process in the West Midlands IG sort of network. It's quite strong, and Paul got a number of his colleagues to peer review those, and also each of the partners obviously fed in and signed those off. James, there's another question from Alison. Can you see that? Or Alison, do you want to come on screen and talk about that?
Okay, is there a danger of staff become reliant on this, and where partner agencies have not joined up, therefore this information could be wrongly assumed? Okay, so again, I think this is, we did talk about it, or it was spoken about in, oh, Alison, you're there. That's hello. Working. There you go. Would you like to?
Because I can't hear you, but if you can hear me,
I can hear you.
I'll come off the screen when you can give me an answer. Yeah, I'm just kind of thinking that, if people, I know you've said there's a memorandum of understanding and how many who signed up to it. I'm just thinking of sort of, any frontline member of staff. I'm just thinking of a recent SAR that we had, Safeguard and Adults Review, and you're kind of like looking at it and you're just assuming that there hasn't been any interaction because there's nothing coming up on the screen, but that's because our neighbouring authorities have not signed up to it, and the member of staff isn't aware of that. That was just kind of the thing, and they might just think, oh, that's it, and just pursue the case on their own kind of thing. But there's a whole heap of stuff going on in the background.
Yeah, so I think the limitation of the MAST system would be how many partners there are contributing data. And you might decide that you have to do lateral checks beyond those partners and beyond your boundaries. Now that would result in hundreds of different phone calls, I'm sure, into different places and different agencies. But yeah, so you have a limitation of how many people have signed up and what the geography of those organizations cover. But in terms of sort of a reliance on the system, I think what we've said is that MAST drives your professional curiosity. So where you see something, then it's up to you to decide whether that's significant or not. Where you don't see anything, I don't think by default you would say there is nothing to worry about, because you still have the possibility of there being other interactions outside of the sphere of MAST or anywhere else in the country for that matter. And how would you know about that? So this is one tool in the armory of the social workers. It's not the only tool, I think, is what I would say. So I don't think you would build a total reliance on what you see or don't see in here. It feeds that professional curiosity. Okay.
Has anyone got any?
Yeah, go
exactly.
on.
Exactly that.
What she said.
What he said. Anyone got any other questions? I mean, so James and I have been talking about MAST now to a number of different areas, haven't we? So we've got Cornwall next week. We did a big London session last week, and there was sort of interest for a number of London boroughs to have a further demonstration. There's lots to show, and we recognise that there's lots of partners you might want to bring to a demonstration to understand the solution. So that's what we're doing now. Now for the next few months, I would imagine, doing sessions of how it's working, and as it rolls out in the West Midlands, evidencing the impact and being able to bring that business case to life. Lucy's asked about costs, James.
In which case I'd happily defer to you on that one. Okay. But yeah.
So again, with all the projects, like we said, we're working up that commercial model, working up a sustainable approach. We have a per annual fee of £14,000 for each instance of MAST. So we think that we need a minimum of 3 partners to bring MAST to life in a particular area. So that would be £14,000, let's say, for the council, for health, or for police, or for fire and rescue. So yeah, it's £14,000 per organisation who's bringing in data. I think there's probably something we need to think about when we look at the next instances in more detail. If one organisation wants to bring, 15 data feeds, or 7 data feeds, or just more data feeds than we're currently experiencing and ingesting, then maybe we just have to look at that as we move forward. But currently, £14,000 per organisation per year.
Because there is variation, there is a difference there from different local authorities. So with Warsaw, we were only looking at 2 data sets from the council, which was adults and children's, whereas other local authorities that we've already been talking to have said, well, education needs to be part of this, and public health needs to be part of this, and ultimately anybody with a statutory safeguarding responsibility can be part of this. So that opens it up to many different organisations. So we have to just be conscious of how many data feeds are coming from different organisations when we do that pricing. Okay.
Any other questions? Oh, there's a question here. Have we done that one? How much it cost? Okay, yeah, we've done that one. That's right. Brilliant.
Great. Well, look, thank you all very much for coming and listening. It's been a really interesting project to work on, and I think we can all see that, and certainly all the partners involved can see that there's tremendous value in what it's doing. In actually sort of in business process way and business analytics way, in a very simple form, and that I think is one of the strengths of MAST through the IG and through the delivery. We're actually bringing great value from a very simple concept, and that's I think that's its strength.
Yeah, and as we said in the morning, it's sort of, it's not that the technology is obviously, works and the platform works and so on, but it's a lot around the IG as well, isn't it? That we've got those documents and all of that kind of hard work, which I think is where a lot of these kind of projects sort of stumble, is creating that sort of information governance sort of foundation. And Paul said it quite well this morning, what is the minimum here that we need to share? And that's what this is pared down to.
And Jane, did you can you see the outcome from the polls?
No, because we didn't tell people about them.
Oh, I did.
Oh, did you?
Yeah.
All right. Maybe it's because I haven't voted. Oh, yeah, we can. Okay, hold on. Let's have a look. Now that I've voted, I can see them. So yeah, I think it's around issues. Yes, separate IT systems mean that you can't see across a safeguarding landscape. I think that's pretty much in South Wales. They sort of they say, what did he say? He had this great line. We have this vision that we'll be able to do this, and they really don't think that they will be able to do it with their day jobs, and this is sort of a solution that does it for them, isn't it, James?
Yeah, their view there was that they've been looking for 10 or 15 years at the promised land of having a shared IT system, which actually is never going to happen. So this is a staging post towards that. So this is the only way it's going to work. Yeah,
and there was information sharing and information governance barriers. So yeah, that's where we started. I think we spent 3 months doing that before we even, or someone's hit a keyboard and started to code. Demand in the system, increased workload and returning NFAs. I mean, that's what drove Paul in the first place, wasn't it? Particularly around the no further actions. People coming in, they just saw time and time again coming into the system, dropping out the system, coming back in. So understanding that landscape was a way that they could move up that sort of scale to prevention and support rather than crisis intervention. Second one, main benefits, lateral checks, informing case closures and referrals, and identification of high frequency cases. Oh, I get my tongue around that one.
Yeah, absolutely. I think it's worth noting that initially in scope, and it still could be done, was to create proactive alerts from the data as it flows in. So the potential here is to be able to continually ingest this information and create trigger alerts where a certain number, a threshold is hit. So you could say, and this is entirely subjective, and I'm just giving you, illustrating the concept. You could say, if I've got 2 fire records, 3 police records, and 6 NHS records over a given period at the same address, that's going to proactively alert the system and tell a user that's happened. And then you have the ability, if you want to investigate that further to see what's going on. Is there an open case? Is there not an open case? Maybe there should be. So the potential in the system is to create proactive alerts. That hasn't been done now, but the potential exists within the system to do that. I think have we got another question?
One more in from Lucy. Lucy, do you want to come on screen, or should we read it out for you? Oh, it's nice to see you.
Hi. I was just wondering about, because this is all sort of under the realm of safeguarding, whether your feeds from children's services included things that didn't get as far as a referral. So depending on how the front door set up, like contacts that were NFA'd or might have gone down the early help route.
Yeah, so that was a really big part of those early discussions in the workshops, to really decide at what point do we share a record. And there was and is, a huge percentage of NFAs. All sorts of concerns are raised spuriously or maliciously even, and not all of them get to that sort of stage where they're taken forward. So a big decision point was, at what point do we share this? And the decision within the Walsall group was that was at the planning meeting stage. So there was a planning meeting, and that was going to initiate an open case, and at that point that case would then be shared. But it's entirely up to you to decide when that is. It's whatever makes sense to you. For us, all we're doing is accepting a record with a name and an address on it to put into the system to match. it's up to you really to define the logic of when you think that is most appropriate. You could do that as soon as it comes through the front door, but I think because you've got such an NFA, well, Warsaw had such an NFA rate, that was deemed not appropriate. So it had to go forward in the process to say, yeah, actually, this is a genuine thing we're worried about, and then it gets shared. But ultimately, you know, from a technical perspective, doesn't matter to the system. It's what matters to the business process, and that's all about what it matters to you. So you can define what that will be.
That's great, thank you.